to today's presentation. Today's presentation is going to be telehealth for today's patients. And I'm really excited about this class because I think telehealth is such an important resource for us to have. Before we begin and before I introduce our speaker, I just want to inform everyone that this session is being recorded, and afterwards you will be able to access it on YouTube by typing NKA Idaho. And just a few of the ground rules. Participants may leave the session at any time if they need to. Microphones will be muted to prevent any background noise or unwanted noises. And if you have questions, which we encourage you to have questions, please put them in the chat box. And you can see there is a chat icon at the bottom of your screen. Click on that, type in your question, and Michelle is going to address all of the questions at the end of the presentation. And of course, it's needless to say that we request professional language and behavior at all time. Oh, and you must wear clothes. That's something that came up the other day. Before we go on, a little bit about NKA. So over 15 years ago, some folks in Pocatello came together and collaborated with Idaho State University to develop NKA, which stands for New Knowledge Adventures. And the volunteers looked at different models and settled on one that had affordable access, volunteer governance, volunteer instructors, and active engagement of the community. It was a very successful program and continues to this day. Then in 2014, AARP, Idaho State University in Meridian, and the YMCA Treasure Valley collaborated and formed a partnership. And here we are today, still active, still going strong, and still dealing with the challenges that come our way. COVID required that we go online in fall of 2020 and spring of 2021. And I'm delighted to say that we pioneered NKA online, and it's been very, very successful. And of course, we have a wonderful group of volunteers. NKA is volunteer driven. And we have committees for everything from curriculum to facilitation. And we could not function without our wonderful group of volunteers. So we are very thankful for the time and energy they give to this program. So now, without further ado, it is my delight to introduce Michelle Anderson, who will give the presentation today. Michelle has practiced as a family nurse practitioner for the last 20 years. She has worked in acute care, cardiology, urgent care, and family practice. She owned her own rural health clinic, health family practice until July of 2020, when she sold it and transitioned to teaching. Dr. Anderson has helped her patients navigate the online strategies for the online aspects of healthcare for the last 7 years. She worked with her patients successfully to utilize information and how to interact with our on the online format. So we are really delighted today to welcome Michelle Anderson and have her share her knowledge with us. Michelle?
Thank you so much, Lisa and Shana, and thank you to Knowledge Adventures for providing me this opportunity to share my knowledge about telehealth. I don't have anything to add to the background or bio, so I'm going to go ahead and start sharing my screen. That's always fun. And I think if I remember correctly, I have a video embedded in here, so I have to optimize my screen sharing for the video clip. And a funny story is that literally just before I was getting ready to come on to do this presentation, our server here at ISU completely blew out, leaving me with having to use a laptop. So I'm going to fuddle through this a little bit. Isn't that just appropriate for telehealth and technology? I actually couldn't think of anything that would be funnier to talk about as my own experience trying to get on to do this with technology issues. Initially, I thought I was going to have to do it on my phone, and that was going to be far more challenging. So I've got a laptop I'm working with. So thank you for being here and for listening if you're listening to the recorder. Some objectives from today is that at the end of this presentation, you should have a greater comfort level in navigating telehealth and online healthcare. We're going to discuss types of visits done successfully via telehealth and how to prepare for that type of visit. We will also discuss how to maximize your visit time to get your questions answered successfully, because you've probably figured out if you've done telehealth visits that your visits are a lot shorter sometimes than what they are in the office. And then finally, we'll review online portals to access your healthcare information and how to interact with your provider in that format. So I can talk about rapid growth and increase in telehealth visits from 2019 to 2020 in one word, and we can call it COVID. That was a predecessor to so many big changes that happened in this past year. Being a patient and a provider during the pandemic has been different, and it has rapidly forced change to meet the patient and provider needs both. This has caused a change in the experience of receiving care, as you've probably all recognized already. Patients have needed to acclimate to new ways of receiving care and communicating with their provider. Providers and healthcare organizations have needed to develop sustainable approaches that align with the shift in patient expectations. And finally, and this is probably the biggest part in all fairness, is policymakers must also consider the implications of virtual healthcare delivery and what that means. And just this past year in the legislation here in Idaho, there were multiple telehealth and virtual care bills that made it onto the floor for many different reasons. I myself actually spoke on Senate Bill 1126 in favor of it for nurse practitioners specifically, but I will tell you when I was testifying in favor of it, multiple physicians groups, PA groups, dental groups, multiple groups were speaking in favor of the benefit of that. So growth is happening, and it happened quickly. So virtual care itself is kind of the new buzzword for telehealth. So what does that mean? It's a pretty broad term. It's used to describe all the ways healthcare providers interact with patients remotely. In addition to telemedicine, in this regards, providers may also utilize live video, audio, and instant messaging. Virtual care by definition is reserved specifically for patient and provider interactions enabled by telecommunications. Inversely, telehealth itself extends to multiple other things other than just the in-person care or the live in-person care via telehealth. It extends to electronic health records, electronic medical records, as well as remote patient monitoring. And some people may have experience with that already, doing at-home monitoring for blood pressure, pacemaker checks. Different at-home monitoring systems are set up already, and that's more in the telehealth component. It actually refers to all aspects of the treatment of various medical conditions that are done without having to see the patient in person, and often includes virtual care. So concerns, I mean, you can't go into this type of appointment and not have concerns about what this may mean for you. And I know the millennials in their 20s and 30s have adapted incredibly quickly. And I will just put a side note that so have my older patients in their 50s, 60s, 70s, 80s, and even 90s. I've done a telehealth visit with somebody in their 90s. So it's not unheard of. Adaptation is possible. So what kind of concerns do we see? For patient concerns, is telehealth meeting your needs? One decision to be made is whether your needs can be adequately addressed virtually, or whether an in-person visit would be needed. Shared decision-making in this scenario may require that your provider encourage you to express your preferences and or concerns about modes of care delivery. So you may have the opportunity to say, can I do this virtually, or is this better in person? In general, they may potentially need to engage with family caregivers to understand patients' social circumstances. Clinicians will also need to discuss safety protocols with patients, particularly when in-person visits are strongly preferred or required. When we know this is an appropriate form of evaluation for the issue, providers need to make sure that they have access to devices that enable telehealth visits and adequate digital literacy. So they need to make sure that you're ready and able to access this type of an appointment. So how can I trust that I am getting the best care virtually? It can be easy to think how trust may be difficult to establish in the context of virtual care delivery. For this to happen, patients need to trust that their providers are giving them sufficient attention to non-COVID related concerns, that they are being truthful about the most appropriate mode of care delivery given the patient's need and circumstances, and finally are able to protect their personal health information, which seems to be a big problem and a big concern people have. It's not unusual for patients to compare their in-person visits to their virtual visits and determine the value and quality of care. And this in essence is really difficult because they're very different types of visits. Your in-person visits typically have a lot more social aspects to them. There's more touch involved. There's more direct feeling and care. It's the nurse or the medical assistant who's taking your vital signs as you enter that room. Whereas when you're dealing with a virtual appointment, it's through a screen, just like how we're talking right now or communicating right now. And that healthcare provider is relying on your ability sometimes to take that vital sign, check your weight, do your temperature, check your blood pressure, or adequately demonstrate what it is your concern is about. So how do you know your privacy is protected? I can tell you that from aside from the common worry of breach in data, that you may have concerns about involuntarily exposing aspects of your lives, such as housing situations or disclosing sensitive information about your clinical condition or diagnosis in front of other household members. There's a sense that when you're at home, you're kind of inviting your healthcare provider into your house, and you are in a certain circumstance. I mean, you can kind of see behind me that I have books and a desk and different things. So there is other visuals. There's screens you can place up to hide some of that if you wanted to, but the best choice is always to find a room that you feel comfortable in and not to worry about so much what people are thinking when they're coming to talk to you in regards to the things around you. It's more about you when these visits are. And then the second part about having family members close by and being scared to mention something for fear that you don't want them to find out what it is you're sharing. That is absolutely, you're right. And in situations like that, I would just most definitely find a room that's quiet and just ask for privacy if possible. You know, when you look at this diagram here, 75% of concerns are that we're not able to provide or conduct a physical exam. There are lots of guidelines out there on how best to conduct a physical exam in a virtual healthcare setting. I have done multiple visits that way, looking at multiple different issues. And there's some things, and I'll talk about this on another slide, that are more convenient for virtual care versus otherwise. But there's a lot we can do. And there are definitely guidelines that direct what's appropriate and not inappropriate for a virtual setting. We talked about the quality of care compared to in-person visits. They're different. They're hard to compare. It's like apples to oranges in all fairness. You know, not feeling personally connected to the healthcare provider, there's not a lot you can do to change that in fairness because we're talking through a screen to each other, right? So it comes down to trying to find that connection. You know, if you've got, when I did my office, I had patients for years and years. So we were able to deal with the problem, but also connect a little bit socially. So they felt that this was a little more personal than just a screen in front of them. Another thing that would be relevant would be hearing and seeing. You know, if you can't hear somebody talking to you well through the computer system or the tablet or phone that you have set up, sometimes headphones will help that. You know, seeing is another thing. You may not be able to visualize the screen well. And so it's working through some of those problems that you're having to get past them. And then privacy concerns, which we talked about. And it's not only patients that have concerns, right? It's also providers. Providers also have concerns about seeing their patients in this way. You know, during the pandemic, I would tell you that 4 out of 5 physicians implemented a telehealth option in their office to provide virtual care and to continue to provide care to their patients. Close to 60% of the physicians providing this type of remote care still had concerns about the quality. So it wasn't just the patients who experienced this concern, it's also the providers who experienced this concern. However, as they became more comfortable with it and they found it as a mode of delivery of care, they got a little bit better with understanding it and following the guidelines and finding that it is an actually incredibly viable option. And half of them who started providing care during the pandemic have indicated that they're going to continue to do so following that. There's definitely some benefit to it and some great visits that can be accomplished this way, maintaining safety for yourselves. So you're not having to always leave your home. The providers who chose not to implement telehealth during the time cited concerns as liability risks. 44% of them were concerned about liability. 29% found privacy or data concerns an issue. 29% were concerned about reimbursement, and that's a fair concern. And 21% found that telehealth was not relevant to their specialty. So there are some certain specialties that telehealth doesn't always do well in. OB might be one of them, obstetrics, gynecology, sorry, bad statement today, a tough word coming out of my mouth. Gynecology, you can do a little bit of things through telehealth. Obstetrics, pretty hard to do because that's a hands-on type of visit. I mean, you can't do a pelvic exam over a computer screen. So there are definitely things that don't fit telehealth, but lots that do. So let's talk about that. What kinds of visits are appropriate for telehealth and virtual care? So think about follow-up visits. These are visits where you've been in the office, you've had an issue or concern, but you really just need a quick checkup. Sometimes there's no benefit to getting into a car, risking health during pandemic time and going into the office when you can just set up a computer or an iPad or a phone in your home and have the visit that way. Management of medication, if you've been started on some recent medications and you just need the 2 to 3 week follow-up after that to see how you're doing on that and you're not having any problems or side effects, a virtual care visit could be a great option there. Chronic disease management, you've got a history of hypertension and or diabetes, COPD. If you're doing pretty stable on that, you just need to do a quick check-in to make sure you are doing stable or you've got a couple questions in regards to that. This is also a really good visit for that. Lifestyle coaching, so you're thinking about doing weight loss or smoking cessation, or you want to start an activity, or you want to address your chronic health condition in a lifestyle choice kind of way, this can be done via virtual care. Sharing test results. How many times have you gone in and had blood work done or a test done at an imaging center and everything's fine, but you have to go back into the office to hear that? Virtual care visit is another great way to overcome that and just do it via telehealth. Medicare chronic care management. And if you get to acute things, flus, colds, allergies, very simple, straightforward acute issues can also be done via telehealth because it's very easy to describe symptoms. There's some vital signs and evaluation techniques that can be done via telehealth that will help differentiate what that is and provide good guidance for you. Parents, brand new parents who have questions, everything's good. They just have a couple questions about when their baby should do this or when their baby should do that. Once again, a great option. Minor urgent care, general health questions, fevers, just questions that you need to be evaluated for quickly, but can have a quick visit in regards to that. Rash is another good one. I've seen many rashes via telehealth and they actually work. Pictures, not so much, but interestingly enough, telehealth and the ability for the patient to move and show the areas is pretty effective. Sports injuries, sprained ankles, sprained wrists, sprained knees. Back pain, I did a back pain injury issue and, I had the spouse there and the patient was consented to having the spouse be present. And I had the spouse go down the spinal processes and evaluate if there was any tenderness there and down the paraspinous muscles down the sides of the back and see if there was any difficulty there. And then once we established that there wasn't, then we did some range of motion activities just to see how that movement was. So there's a lot of things that can be done via telehealth. Probably the biggest visit increase has been mental health. The COVID pandemic is driving enormous demands for mental health to be done virtually. There's been a significant uptake in teletherapy visits. Before COVID-19, telehealth adoption in psychiatry was 80%. But once COVID-19 hit, it jumped up to 96%. And 100% of those in psychiatry reported a willingness to use telehealth and teletherapy in 2020 past COVID and pandemic regulations. They wanted to continue with it. It's been very effective for them. 62% would prefer a virtual visit for their regular mental health visits, even if it's even over an in-person visit to their provider's office. Dental care. When I was talking about in legislation regards in support of the bill, Senate Bill 1126, there was a dentist who talked about her benefits of virtual care and what they can do because they had strong restrictions on in-person treatment. They use telehealth platforms as a way to conduct online consults, prescribe medications, and then screen those in needs of emergency care. But you can't have visits without guidelines, right? Everything's about guidelines these days. And that's important because it keeps everything pretty stable in regards to what's required. And like most things, the Centers for Medicare and Medicaid Services drive what this looks like, from expectations to requirements and finally through to reimbursement. Reimbursement, unfortunately or fortunately, drives a lot of how these visits will look. Payment aligns with the practice's current contract, and it's applicable to state law. And these guidelines are constantly shifting because technology is constantly changing, and it provides increased opportunity for at-home monitoring, allowing for visits to be done virtually that could not have been done that way previously. So guidelines have had to shift quickly too. And the benefit of COVID, as I like to say, there's some silver linings in there once in a while, is that it eased up on the platform requirements. They still had to be incredibly secure, and it had to be private. And health information could not go anywhere else during that time, but also eased up on the way reimbursement looked like. Prior to COVID-19, telehealth visits were reimbursed incredibly low. But once COVID came around, they were reimbursed at an equitable rate to an in-office visit. So it allowed for that type of presentation of a visit to really flourish. Now that's kind of changing a little bit. All insurance companies are changing now, kind of scaling it back down a little bit. So this is where y'all come in and you check out your insurance and see what it shows for that. Oops. Let me go back. So how do you maximize your time? So there's several ways to maximize your time during a virtual care visit, because if you've had any, you realize they're probably pretty short. I know the ones I've done, I'll typically do a 20 or 30 minute in-person visit, but a lot of my telehealth visits were between 5 and 10 minutes at the most. I mean, it's pretty succinct time. So you want to make sure you've got your ducks in a row and you're ready to go on this. So you first off need to understand how to connect with your provider. You need to be aware of what sort of software you need to download, what that's going to look like on your end, what your requirements are. And the provider who you're seeing should provide you with that guidance. Somebody in their office should be able to walk you through what that looks like. Second, you want to make sure to ensure your device is fully charged. Whether you choose to use a cell phone, a computer, or a tablet, make sure you have good battery life or that it's plugged in to a charging source while you're having the visit. We hate to lose you mid-visit due to low battery, and it's really hard sometimes to reconnect, and it's frustrating for everybody, including you, specifically you guys. Then find a quiet and well-lit space. This is similar to in-person visits, right? We have you come into the room. We usually have really good lighting there present so we can see your color of your skin really well and what's going on. We want that same option when it comes to doing a telehealth visit. You want a quiet room. You don't want a lot of background noise. And we can tell a lot by being able to visualize you really well. Make sure you're not in front of a window, because if you're sitting in front of a window, you get a lot of backlighting. I mean, if I was to switch this around and put this to the window, you wouldn't hardly see my face, but you'd see all the light behind me. Be careful not to have that. If you're gonna have anything, have the window in front of you so it really lights up your face really well, so we can get a good visual. And make sure your camera's on you directly and not the ceiling or the ground. I always say that I think we can determine sinus infections very well. I talked with my mother multiple times via different online formats, and I have seen up her nose several times, so I know we're all like that. The screen's all over the place sometimes on Zoom calls. I mean, there's so many funny Zoom memes out there right now, but have the camera forward on your face when you're having the conversation and have good light. And then treat this visit like it's an in-person visit. Be on time, be prepared, but be patient, as we are well aware of the glitches that come with technology, as I indicated at the very beginning of this. I'm doing this on somebody else's computer. I'm not familiar with the buttons I'm pushing. I'm just happy my PowerPoint presentation presented here and that I had somehow miraculously saved it to my email last week so that I could access it in this moment in time when I can't get it anywhere else. Also be familiar with the fact that there can be a voice delay in response. So it might be that I ask a question or you ask a question of me, and it's delayed coming to me, so there's some overlapping conversation. Just hold that out. If you recognize that, just be patient and wait that voice delay out. It's unusual, but it does happen. And I'm hoping this video will work. Like I said, it's not my system anymore, but this is a really good clip on preparing.
To start your visit, we recommend that you use any brands of laptop, tablet, or phone. These devices allow easy manipulation of the camera position, Make sure the device is well charged before and during the visit. Please sit in a private space that is well lit or face a window. Avoid having a window directly behind you to prevent backlighting. It can be helpful to rest your device on some common household items in order to keep your hands free and easy to maneuver when we do the exam portion of the visit. Make sure to adjust your device to show more of you and less of the ceiling. When we examine the lower extremities, have something to lean your device against so we can see your legs and feet. Try placing the device at least 6 feet away from you so we can examine you walking to and from the camera. It would help with our exam if you have a blood pressure cuff, a scale for weight, a smartwatch, or a flashlight ready. But don't worry if you don't have these. Please have your medications handy for reference. It may be helpful to have another person join you for the visit, like he or she would for an in-person visit. Lastly, don't forget to send any outside medical records or images prior to your visit. Hope that helps. We look forward to meeting you soon.
Okay, yay for the fact that it worked. I'm happy. So there's lots of different formats that can be used. Your provider should provide setup instructions and expectations for the visit. Some examples include Zoom, MyChart, St. Luke's uses this one, Athena Telehealth, UpDocs. I actually used Facebook Messenger video from my visits at the start of COVID and then switched over to Doximity video where I could just video call the patient at their appointment time. The requirement for that involved a phone with a camera. Requirements were a platform that offered privacy. So prior to COVID, there were a lot of restrictions in regards to platform requirements. So it sometimes made accessing telehealth for providers to set that up very expensive. But with COVID, they found other platforms that worked that were less expensive. So it made it easy for everybody. And it's sometimes things that you even have and are familiar with. So the video talked a little bit about how to prepare. I'll talk about a little bit about this further with some things they didn't talk about. So talk to your insurance company about coverage and copays. Avoid any unexpected bills by checking with your insurance company to see if telehealth appointments are covered. While some states have required insurers to cover telehealth visits during the coronavirus pandemic, and Medicare has actually expanded its coverage for these consultations, not all insurance companies cover telehealth or limit coverage to COVID-related problems. So just take a look into that, and that's changing a little bit as we're kind of hopefully on the tail end of where we're at here. And for those that do offer coverage for telehealth appointments, you may still have to pay a copay, so know that. It may be just considered just like any other visit. So regardless of your insurance coverage, all information shared during a telehealth appointment is covered by HIPAA laws, and you're well familiar with HIPAA and protects your privacy. So write down your symptoms. This is another part of being prepared. If you're sick and you need to provide as much information as possible to the provider during your telehealth appointment, make a list of all your symptoms and how long each one has been present. For instance, if you have or had a fever, be ready to state how long the fever has been present, what the highs and lows were, and any medications you took to reduce that fever. If you have a visible problem, such as a rash, and we've talked about that a bit, take a photo or be prepared to show the rash to the provider using video conferencing. State any pre-existing conditions you have. During your telehealth appointment, your provider will need your medical history. So write down any pre-existing conditions you have and how long they have been present. And you may have been seeing this provider for quite some time. And you may be able to skip the in-depth history, but they will probably ask if anything's changed since your last visit. So be prepared for those questions. Likewise, if you take medications or supplements, you want to have those with you. You want to indicate what they are and be asked to have them present, maybe as they indicate in the video right beside you during your visit. So you can just pick them up and look at them. Be prepared to present a comprehensive picture of your medical history and current health status for the provider to properly evaluate your condition. Put your medical devices you have close at hand. So if you have a thermometer or blood pressure cuff, a glucometer for measuring blood glucose levels, a heart monitor, or even a bathroom scale, have it close by during your telehealth appointment. It's possible your provider may request a current reading while you're talking, and you don't want to waste time retrieving these devices during that call. At the very least, take a reading prior to your telehealth visit from each of these devices, if available, and record that reading and the time of the reading in your notes to discuss with the provider. And write down your questions. I mean, this happens in in-person visits as much as it does telehealth visits. You know, you've got all these questions, you're ready to come in, and then you get in that office or you get on that call and it's just gone. You just can't even think of what they are anymore. And if we're unable to prompt you, you may not remember them until, of course, the call has ended or the visit has happened. So write them down, make a list of all the ones that you have. It can be easy to forget or get sidetracked. Have a notepad handy too, so you can record the provider's responses and make notes regarding the information and instructions the provider shares with you during the call. And we talked about this a little bit already, but find a quiet spot for your telehealth appointment. You don't want your virtual appointment interrupted by your roommate, your spouse necessarily, unless they're there with you, the kids or the dog. Many dog barking Zoom calls I've been on. So find a quiet spot for your consultation. Turn off the TV or the radio or whatever background noise that you have going so it doesn't interrupt your visit, but it doesn't overlap your visit either, so it alters the way you're able to hear what's coming back at you. And it reduces distractions for sure. You may want to even use, we talked about this a little bit, earbuds or headphones to further reduce outside noise during your call or video conference. And if you've got a difficult time hearing, those earbuds or headphones may help accentuate that and focus it in so it's easier for you to understand what's being said or asked of you. And then prepare your devices beforehand. By their very nature, telehealth appointments require technology to facilitate the consultation with the medical provider. Whether it's a cell phone, a laptop, desktop computer, make sure it's fully charged or plugged in and you have a reliable internet connection. It's kind of funny today, but yes, reliable internet connection. I'm currently using my hotspot on my phone to make this lecture go. Also download any required applications or software program utilized by the medical provider in advance of the appointment and set up your account or login information ahead of time. So you're not doing it 5 minutes before the visit and you're like, oh my gosh, I don't have this all ready to go. The telehealth provider will give you the instructions beforehand. Make sure the lighting is good in the location you want to use for the virtual appointment so the provider can see you clearly. And then be ready for an in-person follow-up appointment. So while telehealth appointments can be a great way to see a provider without leaving your home, there are some cases where an in-person visit is necessary. Therefore, don't be surprised if the provider directs you to follow up in person to make that follow-up appointment, or if it's urgent enough to send you to the urgent care or the local emergency room. So be prepared for that, depending upon what you think you're visiting for. If this turns out to be the case, remember to bring your notes from your telehealth appointment to the in-person appointment so you can advise your doctor on the information you received during that virtual call. All right, so let's talk a little bit about patient portals. I think these are the bane of everybody's existence, but they're in all fairness one of the best things that are out there for a couple reasons. And I'll talk about what those reasons are, but they are a really good format for viewing your information and taking charge of your care. And a lot of people are intimidated by going on and looking, but once you become familiar with it, I think it's amazing. So it's something that's arisen from the introduction of electronic health records. There are privacy and security safeguards in place to protect your information, and they're hosted always on a secure connection. They have an audit trail on them, which keeps track of who has access to your information. It's part of the requirements. So let's talk a little bit about the pros. The clearest benefit is the added ability for communication between you and your healthcare provider, and this is most notable with regards to chronically ill patients. These patients are able to message their provider with simple questions, reducing time on the phone and decreasing unnecessary office visits. Sometimes you may have a simple question that just needs to be answered and it doesn't require an office visit. So you can send a message through your patient portal and 9 times out of 10, they'll respond and get back to you in regards to an answer. If they think the question is relevant for an in-person visit, they'll often say that also. You'll have more complete and accurate information using a portal because what happens is you're able to access what's on there and you can take a look and see if there's any discrepancies or inaccuracies in what's documented on your health, your prescriptions, your history, any of that. It's pretty nice that way. This can empower you and give you ownership of your own care, which is I think what most people want nowadays, is to be a valued partner in your care, not being told necessarily what to do, but being shown how, and you're a partner in that choice. It empowers you to do all of that. Your perspectives foster shared decision-making. You can put the knowledge you learn by accessing your records to using more learning about your health issues. You gain more insight into what your provider thinks, and you advocate for yourselves in the discussion of your care. So you may see when you're not learning this information right in the front of the provider, it gives you the opportunity to research it, to learn about it, and to get very knowledgeable about it. And when you get very knowledgeable about your own healthcare, that's definitely a strength because you become your own best advocate for that. It will also give you 24-hour access to personal health information from anywhere with internet connection. You're required to use a secure username and a password, and it's super convenient if you're traveling or splitting residencies between areas and or states. When I was up north with my practice, I had lots of patients who summered up there and then wintered down south. And with this, if they had an issue and they're away from my office, they could go on, access their portal. They could look at previous lab work. If they're having new lab work done, they could share that with the provider down there. They could see when they last had something done, if that was asked, such as a mammogram or colonoscopy. If there was some issue going on, they could access that information pretty quickly. And that is just great for continuity of care. It's great for cost of care because it decreases replicating services that don't need to be replicated necessarily. So it gives you control of your own healthcare. It saves you time through eliminating phone tag. How many times have you called the office and you leave a message and it's hours, if not 24 hours after, before you get a phone call back? You send a message through the portal and it flags your provider, and it's almost instantaneous because it's one of those things that we see when we're doing electronic records. Get that flag, you can't ignore it for too long. You want to go and look, and then once you look, you want to address that concern right away. So it's a pretty easy way to get back to your provider too, or somebody who's assisting your provider. So, and it's good for support care in between visits. So if you got a quick question, but it's not necessary for a visit, you say, hey, I started this prescription. I couldn't remember. It says on the bottle here, I thought I heard it this way. Is this how you want me to take it? It's all just good for confirmatory care. So what are the cons? We talked about some great pros. What are the cons? So of course, healthcare data security, same with what we had concerns about with telehealth. But I will tell you, they're hosted on a secure connection and they're accessed through an encrypted password protected login. So it's well secure. There's strong HIPAA laws and rules out there, and there's not a single office or software that wants to have a HIPAA violation associated with it. So it's pretty secure. There's audit trails, so you can see who's been accessing your records. And it's actually one of the requirements as providers or offices that have electronic health records is to have a safety plan in place where you have the ability to audit and look at who's been accessing charts. It's one of the ways to know whether your chart's been accessed appropriately or inappropriately, either way. There's a lot of fines that go with inappropriate access. It's good to see what changes were made, who made them, what time they were made, and when. You should always protect your username and password for others and make sure to only log on from your own personal device. So you don't want to be in the public library visiting someplace and all of a sudden put all that incredible information onto that library computer or that software device system set up in a coffee shop or anything like that. You definitely want to do it on your own personal, so tablet, phone, or personal computer. For whatever reason, it's been hard to get patients to utilize this service. Patients seem less excited about using a portal. You could tell me why that might be, and hopefully you're getting better at it, because just think about it as a secure email system. It's a great messaging system with your provider, and it's incredibly secure. Often those messages go directly into your chart, so they're easy to track. You can't say, I sent that message, and then somebody says, no, I never saw it. That's all tracked there, and it's usually added into your file when it's received. So if you use the internet, this is just as easy to navigate as the internet once you get familiar with it. So just know that. So how can you interact with your provider in an online portal? So this little graph here shows some of the most common ways in adults age 50 to 80 of ways to use the patient portal. You definitely want to ask your provider to gain access. And this is often given at your first visit or the first time they've implemented this software. I used Practice Fusion myself in the past, and my patients were not only able to look at their lab information as it became available, but also their whole record. And that is, like I said, super user-friendly. They could let me know if I had documented something incorrectly or if something needed to be corrected or changed. That happened a couple times. We are not infallible when it comes to documentation. I used a voice-over dictation system. So often I would say something, and I'm Canadian, so sometimes my sounds are a little bit different, and the computer picked it up a different way. And if I didn't catch it, that was now in the chart and signed off. And so when I'd come back and follow through on whatever I had documented, I'd have to read it quickly phonetically to see what it was I might have said, and then I have to put in a correction. So it's really helpful. And if you're paying attention to that too, it also is helpful. There was also a messaging function that would notify me when I had a message waiting from a patient. It prevented me from having to try and get through the front, prevented people from having to try to get through the front desk to get back to me. Super helpful. And it's very easy for me to stop in between patients and address a couple quick concerns and then go back into the room. So there's a lot of benefit to that. When you get on a phone call, typically we have to take those at the end of the day because we have no idea the length of time that phone call may be. You know, somebody has just a quick concern, but while I've got you on the phone, I have a couple other concerns. Well, all of those would have been done just as quick through an email. And sometimes you get a more thorough response because the provider will address those sometimes in off hours where they can go back and really put some effort into it, as opposed to being rushed through a phone call. So it's definitely better for your healthcare. And the provider I actually see now has a similar system set up where I can request a refill access through my portal, and they'll approve it or not approve it depending upon the request and whether or not I need to come in for a visit. So I think those are super helpful. I think that just benefits all your care. So then I've got questions here. So your patient expectations are likely to evolve as you acclimate to virtual care delivery options, and how we as clinicians and providers respond and adapt to these expectations. It's going to shape how healthcare is delivered beyond this current pandemic. And I'd like to thank you for your time, and I'll entertain any questions that you may have.
So far, I don't see any questions in the chat box. Is there anyone that has a question of Michelle? I actually have a question, Michelle. How do you see telehealth evolving post-pandemic? And I know that you've been involved in telehealth support for far longer than the actual pandemic. So what trends do you see for the future?
I think because it had such a fast growth during the pandemic, it's not going to go away. It was like a really slow trickle up, and then the pandemic hit and we had this huge trajectory forward with it. And it was hard to keep up with all the guidelines and requirements. So I think what we're going to see now is a bit more of a plateau, and all those other things will start to catch up. So ideally what I mean by that is policy will catch up on regards to reimbursement and the guidelines and the requirements behind it, as we're starting to see in Idaho in the legislation. We're going to see that in all states and probably on some federal level. During the pandemic, it was the federal level that lifted the requirement for the platform of it. It also altered the pay scale for it. It forced that alteration. And what that did at that time was it equated an office visit with the same reimbursement rate as a telehealth visit. Now that we're kind of at this plateau, you're starting to see that phase out a little bit, and you're starting to see some of the reimbursement rates come down again. And I think, unfortunately, like anything in healthcare, reimbursement rates are going to drive a lot of how telehealth is used in regular medical care. Now, when you talk about mental health, I don't think it's going anywhere. It wasn't before. It was really strongly used before. It was one of the strongest areas where you saw telehealth utilized. And I think I said at 80%, and it went up to 96% usage. I don't think that's going to go away. You also had some patients who got really comfortable with having their visits from their home. I mean, you didn't have to get up. You didn't have to deal with traffic if you live in an urban area. You just had to deal with technology. And if you could deal with the technology successfully, then it seemed like a really nice option. So I think we're going to see a hybrid going forward.
Good. Another question I had is my husband has to make an appointment for some test results, and he asked if I would go with him, and I said, they're not going to let me in the door. You know, they right now the doctors are still making you call in from the parking lot, and they let you know when you may enter the building. I said, ask for a telehealth appointment and I'll sit right next to you. And that way we can both participate. So like you said, for test results, it's a great option.
It is. I mean, I know a lot of people like to go back in for their test results, but there's some who don't. There's some who'd prefer just to get that phone call that says, hey, everything's okay, or not. Or if the hybrid of that is the combination between in the office or the phone call, is that quick little telehealth visit. How nice is that? Because as a spouse, you could sit there and ask questions that your husband may be unaware of or unsure of what he wants to ask.
exactly.
You know, how many patients just completely freeze when they're in that setting, whether it's in a room or on a visit. And what a great opportunity to have that support person right beside you and not have the restrictions that are currently in place limiting that.
The other thing that kind of comes to mind has to do with underserved communities in terms of a shortage of doctors or nurse practitioners, and how telehealth can really become a great resource for those communities. Do you see that happening in any parts of the country?
You do for sure. I mean, for low income families, you know, it still comes down to reimbursement. But that being said, there's so much less manpower and overhead that goes into telehealth practice or telehealth management that those costs can come down for that. So you can definitely hit lower income. When you're looking at rural health, for sure, but once again, it's all going to be dependent upon internet access and reliability of internet access. And that is the biggest deficiency I recognized up north. You know, whereas mountains and lakes, and there's a lot of things that will interrupt an internet speed or a bandwidth. Sure. And then you have to alter it a little bit more. Then maybe it becomes a video phone call versus something that's an internet-based system, but it's adapting to it. And yes, when you're talking about lack of providers, if you've kind of got a central area, you know, talking about the change in visit time, an internet, a telehealth visit, 5-10 minutes usually is about what the max is, unless you've got something much more engaged, such as a mental health visit, you know, versus your 20-30 minutes in an office. You definitely can see or access a lot more patients doing telehealth visits. So therefore it can pick up some of the issues that you'll find in a rural or underserved area.
Are there question that I had was about, I spend about a third of the year in Arizona and the other part of the year in Idaho. And I suppose since this is being recorded, I shouldn't say this, but what I learned was I shouldn't tell my whoever the telehealth person is where I am, because if I'm in a different state, apparently there's rules about your license in one state, but I'm in another, and it's crazy when we're doing exactly the same thing that we would be doing if I just happened to have flown into Boise.
Absolutely. And it comes down to the policy I was talking about with all those bills that are currently in legislation. The requirement for telehealth took off faster than policy and guidelines could catch up to it in some levels. So that's something you're going to be seeing in a lot of states going forward. There are some policy bills in Idaho legislation that I think are on hold now because the session's over, but dealt specifically with what you exactly just talked about. We're trying to alter and change that a little bit. Now, that being said, you also want to make sure that patients always getting the best service possible, and you don't want necessarily big organizations coming in, taking over management or care for patients that will not have the follow through or care of them that their own provider would have. So there's a tight little balance walk there. You're correct, but that's where the patient portal comes in, right? I mean, it may not be a direct visit, but you can access your portal in another state when you're out of Idaho and message your provider that way. And there's no limitations on that communication.
Great. I had no idea. That's interesting.
Yeah, it's crazy. I just had a regular appointment and I didn't think anything about the fact that I was in Arizona. I just, you know, it was a telehealth appointment. I was like, great. And then, yeah, because I was out of state, we couldn't do it.
Oh my.
It's fast moving legislation trying to catch up with the mobility of people and this new technology in healthcare.
Yeah, we're treading on uncharted territory here, and good information. Any last questions? I did want to, in the chat box here, provide some information for people. Let's see if that doesn't want to go through. Excuse me 1 minute here. I am trying to provide the information for Kathy McDougall's contact. Michelle, your class has been just fascinating, and I can say how much I appreciate the option of having telehealth for some appointments. And very, very interesting information. I think it's here to stay. And I want to thank you for your time today for NKA. And so Michelle Anderson, Dr. Anderson, thank you so much. And if there are no further questions, I think we can end the session.
All right.
Thank you very much for this opportunity, and I've appreciated working with you.
We appreciate it. Thank you.
Thank you.
Bye-bye, all.